I'm Dr. John McDougall, and fat is something that is number one on my concern for people consuming. One of my mentors, Nathan Pritikin, used to call it lipotoxicity. And he was referring to all kinds of fats, good fats, bad fats, vegetable fats, animal fats, whatever kind of fat you want to mention. It was lipotoxicity. For one thing for sure, the fat you eat is the fat you wear. And I don't care how many health promotions are associated with that particular fat, you're going to wear it. It goes from my lips to my hips, because the primary purpose of fats and oils is storage for the day when no food is available. That's why you have body fat. It just moves it effortlessly. In fact, so effortlessly that I can tell what you like to eat in terms of fat by biopsying your body fat. I can take a needle, I can stick it in your buttocks, thigh, abdomen, I can take it to the lab and I can analyze it. And if you happen to be into, say, trans fats, Crisco's and margarines, your body fat's going to be full of trans fats. You happen to like fish oils, omega-3 fats. When I take that biopsy, you're going to be full of omega-3 fats, and so it is. Whatever fat that you have to consume, and I don't care how much you paid for it in the natural food store, it's going to be in your body fat. So, that alone should discourage most of you from consuming these good fats or bad fats. As far as general categories, the animal fats or saturated fats would be thought of as bad fats. The plant fats or vegetable fats would be thought of as good fats. Well, let's just agree that the animal fats are bad for a whole bunch of reasons, including killing the animals. And these saturated animal fats are associated with damage to the arteries. And I think that's true. So let's go on to the vegetable fat thing. Vegetable fats have been declared as being healthy for you, and you need some vegetable fat. But guess what? That vegetable fat's in the vegetables. All you need, you never miss. So you say you focus on eating high concentrations of these vegetable fats. Say you eat a lot of fish oil or eat a lot of fish, that'll do it. Well, the thing that fish oils do, or omega-3 oils do, is they do two things that are important to you. In addition to the fat you eat is the fat you wear. They cause bleeding. In fact, bleeding to the point where the Inuit Eskimo is known to die of fatal nosebleeds because they consume so much fish fat. So it'll increase your chances of bleeding, which of course lends to the positive side because it thins the blood and may decrease your risk of having a blood clot, which gives you a heart attack or stroke. So now you know the negative side. The other negative thing about these vegetable fats, these omega-3 fats, fish fats, etc., flaxseed, you would identify them as flaxseed. The omega-3 fats is they suppress the immune system. So, say you're trying to battle against cancer or you're trying to avoid a viral infection, you have an increased risk of having problems with both. And the studies are absolutely consistent, and that is that vegetable fats promote cancer even more than do animal fats. And also, vegetable fats cause suppression of the immune system in terms of infection. When you count the amount of fish that people eat, and you compare that to the risk of getting viral infections, there's an increase in viral infections that's shown amongst people who consume a lot of fish. Now, when it comes to the other type of good fats, which are omega-6 fats, we used to feed a lot of these omega-6 fats to patients in the 1970s to try and prevent heart disease. And what we found when we followed them up for 20 or 30 years is that these omega-6 fats that are found in corn oil, for example, these omega-6 fats are even more toxic to the arteries than our saturated animal fats. So, I don't know how defined you can get as far as this special fat or that special fat, primrose oil fat. There are all kinds of fats that are derived from various nuts and seeds. They're going to have qualities. They are not natural. You get these fats and oils by processing the original seed or nut or plant. And as a result, because they're isolated, concentrated nutrients, they should be classified. They must be classified. They're correctly classified as drugs. And drugs have positive effects and adverse effects. You're going to have adverse effects with every one of these kinds of medications. I don't care what it is. And I know you'll be sold the product based upon the positive effects, but don't buy into it, folks. You need to eat a starch-based diet that's got all the fat you need in potatoes and rice and corn and wheat and oats, etc. It'll supply it in the proper amount. It'll supply it in the proper environment, mixed up with proteins and vitamins and minerals and all kinds of other plant substances. So the fat isn't toxic like it would be in a bottle. That's isolated, concentrated fat when you take it as a supplement. Big difference. So get your fats from plant foods, and you won't have all that extra fat to wear, and you won't have all the toxicity associated with the very questionable benefits. I hope that helps you understand. I'm Dr. John McDougall. Thank you very much.